Welcome to Cancer 101. Today I'm going to be talking about pathology reports. We're going to look at a specific pathology report, kind of analyze it, explain terms, and see what kind of information you can get by asking your doctor for a copy of your pathology report. Now, you may have more than one pathology report, and so be sure to ask for any reports that have ever been done. You may have had multiple biopsies, and so it would be good to see what those are. You'll see from this video that we can learn a lot from looking at pathology reports. And so again, I would encourage you, as I have in other videos relating to pathology reports and tumor staging and tumor grading, that you really should get a report if you can. So what I'm going to be doing is putting up this pathology report right about now on the screen. It's very densely written, so it's hard to read. What you might want to do is pause the video occasionally or review sections of the video so that you can read what it is that I'm talking about on the pathology report. Now, what I've done is underlined a couple of areas or sentences in the reports in different colors so I can refer to them and you can easily find what I'm talking about as I explain the report. You can read what's actually written on the report. So let's look at the section sort of near the top third called Specimen Received. You'll see numbers 1 through 7, and those are the actual tissue specimens that they're looking at. Some are a lobe from the lung. Also various lymph nodes are looked at and designated by number. And down below, and then in the diagnosis section, what you'll see is those numbers used when referring to whether they found cancer in them or not, and more detail about each specific item 1 through 7. So take a moment to look at the area called Specimen Received that I've noted sort of with a yellow bracket. And just look at that for a moment, and then we'll continue. Now let's go down to the bottom to the section called the diagnosis. In that area, look at number 2, and it says right middle lobe. That was the specimen received, so in other words, this was a lobectomy, meaning they removed an entire section called the lobe of the lung. And so we're dealing here with a possible lung cancer because that's what they removed. The lungs have distinct separate lobes. I believe in the left lung it's 2 lobes, and in the right lung it's 3 lobes, and that's typical for most people. And what they want to do is remove the entire lobe, even if it's a small tumor. Surgically, that's easier, and also you have a greater chance of getting all of the cancer if you can remove that entire lobe that's involved. Okay, looking at the diagnosis area, I've underlined something in red, and it says negative for malignancy. Malignancy means cancer, or some kind of cancerous growth, or indicates cancer in some way. So negative for malignancy means in those tissue samples, there was no indication that there was any cancer in them. But what are they talking about? What tissue? And so you see it's for numbers 1 and then 3 through 6. So if you look up above in the specimen received area, you'll see what number 1 is and number 3, 4, 5, and 6. And those are mostly lymph nodes that they're talking about from different areas near the lung or that drain that part of the lung. And so they're looking to see if the cancer has spread there, because that's one of the important things to find out when you're doing staging, is to find out if there's some dissemination of the cancer from the original area where it began to lymph nodes in the area. That's called a regional metastasis, as opposed to a distant or widespread metastasis. And now in diagnosis, look at number 2, and there it says resection of the right middle lobe. Resection means surgical removal of something, which you probably already knew, but I just wanted to mention it in case you didn't know that word. Now I'm going to put up a second slide. This is to discuss other areas of the same pathology report. And by the way, this pathology report is just a general pathology report. It's not for an actual patient, or it might have been an actual patient, but of course they don't give any of the details like name and so forth. So in this one, look at the red underlining. They use the word invasive. What does the word invasive mean? Essentially it means cancer because only cancers tend to invade other organs and other tissue. So that's one of the problems, one of the dangers of cancer is it tends to go where it's not invited, where it shouldn't be, and that's why they call it invasive. So when it's talking about invasive, it typically, you're assuming there that they're talking about cancer invading into other tissue. It mentions moderately differentiated. Now this goes to not staging, but grading. And in my other videos I've mentioned grading. And grading is where you try to get a handle on how aggressive the cancer is likely to be. And so oftentimes they'll use words like poorly differentiated, or moderately differentiated, or well differentiated. And that's from bad to good in that order. So a moderately differentiated tumor means it's not the worst kind, it's not the best kind, it's not the most aggressive, it's not the least aggressive type of cancer. It's somewhere in the middle. It also mentions an adenocarcinoma. Now, carcinoma, as I've talked about before, is a general category of cancer involving epithelial cells. Epithelial cells line the surface of organs like the inside of your mouth or the inside of your colon, and they comprise about 85% of all cancers. So epithelial cancers, called carcinomas, are very common, and that's what we have here is a common run-of-the-mill lung cancer. It is called a non-small cell lung cancer, and I'll talk more about that in a moment. What is the ADENO, adenocarcinoma part? Some people say adenocarcinoma, but typically adenocarcinoma. The ADENO prefix indicates glandular structure. Okay, so many cancers are adenocarcinomas. They begin in these surface-like cells that have a glandular type nature. So since this is an adenocarcinoma, that's about 40% of all lung cancers according to the National Cancer Institute's PDQ database. That's at cancer.gov, and we'll be talking more about that in a moment, and how to find information there specifically on being able to read your pathology report and see what it's saying. So adenocarcinomas for lung cancers fall under the category of non-small cell lung cancer. The other major category for lung cancer is small cell lung cancer. But typically it's a non-small cell lung cancer. Typically it's an adenocarcinoma. And the subtype, the specific cell type is acinar cell, as you can see there, ACINAR. That doesn't really matter. What matters is that you have an adenocarcinoma, which means you have a non-small cell lung cancer, and that's the information you're going to be looking for. Non-small cell lung cancer, not small cell lung cancer. Okay, look at the section I've circled in orange with the numbers and letters. That's part of the TNM staging system. It says P, T2A, and 1. Ignore the P. Look at the T2A, which is the tumor for TNM. The TNM staging system, as I've discussed in other videos, stands for tumor. T is tumor, N is nodes, meaning nodal involvement, lymph node involvement, and M stands for distant metastasis. In this case, you'll notice we're missing the M, and that's because this report is only dealing with the tissue removed from the lung and the localized lymph nodes in that area. It's not discussing really whether there's any distant metastasis evident, and that would require other types of testing to do, and that's why it's not mentioned here. So they would call that MX, X meaning unknown at this time. Or maybe your doctor already knows or somehow has already seen evidence that your cancer has spread to your bones or to your brain or something like that. In that case, it would be an M1 for distant metastasis. Metastasis meaning spread of the cancer to other areas. And an M0 means there is no evidence. We've investigated and we've found no evidence of distant metastasis. But what does the T2A mean? Well, T2 has a very specific meaning for non-small cell lung cancer, and so does N1. And these designations get very, very detailed. And if you want to read that detail, the place to go is cancer.gov. And then you look up your cancer, non-small cell lung cancer in this case. And you don't look at the patient information, you look at the health professional information, and you go to the staging area. And in that staging area, if you scroll way down, you'll see the TNM designation for this. And you can look up this specific designation and see exactly what they're saying. Okay, exactly what it means. I'm going to be doing another video with another pathology report so we can get a look at a second pathology report, pick things out, see what's relevant, see what's not. You'll notice that on this report, if you go look at it carefully, there's a lot of information on there. And quite honestly, a lot of the information is not helpful to you, or is not really relevant. But you can get the most bang for your buck by looking at the things that we just talked about. And also underline other things that you're not sure what they mean, or whether they're really relevant or not. Because the pathologist provides a ton of detail that oftentimes is not particularly useful, but they do that because that's what they do. That's how they lay out everything in great detail, just so they don't miss anything. But you can underline things you're still not sure about, and then ask your doctor, and say, well, what about this thing here? Is this relevant? Is this important? Does this change my prognosis or my treatment options at all? And most of the time, it probably won't. That is for things that we haven't really discussed in the report. The things we did discuss are relevant and important and will significantly impact your prognosis and your treatment options. Okay, here I'm going to quickly show you how to get to this information that I just talked about. You go to cancer.gov, cancer.gov. Notice that it's not .com, it's .gov. It's a government site. Here we can see the National Cancer Institute's PDQ database. This is the most trusted information you can find on cancer. So in general, any questions you have on your cancer, go to this site first. Now, what we're going to do is different ways we can search, but I'll select menu, and then I'm going to select cancer types, cancer by location, body location. Probably the easiest way is to simply do A to Z list of cancers. I look for L for lung cancer, and here we have lung cancer, and this is the patient version. Now I need you to go here. See where it says health professional version? We want to see that information. The patient version will not have the kind of information I'm talking about. Okay, here we are in lung cancer health professional version, and what we want to do is go to treatment. And then we select non-small cell lung cancer treatment because we've been talking about non-small cell lung cancer. So you have to know whether you have small cell or non-small cell to be sure you're looking in the correct information, and you want to do that by speaking to your doctor. And then we look at stage information. You see here stage information for non-small cell lung cancer, and it gives a tremendous amount of information, more than you could ever possibly want. And to get to the the T2A N1 information, you have to scroll way down, and then you get here to this section, definition of TNM cancer, right here, AJCC stage groupings. And then you can see here, for instance, I'll just scroll. Here we have a T2B. So I've already passed the T2A, so I'll go backwards. And I'm looking for T2A. Here's T2A, but it's N0. I want T2A N1. And so basically you're going to search through and find there, and then it starts telling you a T2 tumor is between 3 and 5 centimeters and blah, 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 and it goes into all this kind of detail. So you'll learn more than you ever needed to know about your specific stage of cancer.